how to stop hiccups instantly works every time. What if I told you that the most popular tricks to stop hiccups are actually completely useless? But there is a simple, scientifically proven vagus nerve trick that stops them almost instantly. Almost everyone has been there at some point in their lives. You are enjoying a quiet meal, sitting in an important meeting, or simply having a conversation with a friend, and suddenly your body releases that
Great
loud,
idea.
uncontrollable, and highly embarrassing sound. In my years of clinical practice, I have had countless patients ask me about this strange bodily reaction, often frustrated by myths like having someone scare you or drinking water upside down. Today, we are going to look past the old wives' tales and get straight to the science of what is actually happening inside your body. We are going to explore the biology of why your system acts up, look at the absolute best hiccups treatment methods, and discuss how to stop hiccups fast so you can finally get back to your day without the constant frustration. If you are tired of dealing with these sudden interruptions, you are in the exact right place. Hello, and welcome. I'm Dr. Matthew Harrison. On this channel, we break down complex medical topics into simple, actionable daily wellness steps so you can live a healthier, happier life. If you believe that understanding how your body works is the first step to living a healthier, more comfortable life, please take a quick moment to subscribe to our channel and hit that notification bell. By joining our community today, you ensure that you never miss a critical health guide, while helping us share these essential wellness resources with millions of others who are silently searching for reliable medical answers. To understand how to stop hiccups, we first have to demystify what are hiccups and why do we get hiccups in the first place. Biologically speaking, hiccups, known medically as singultus, are not a disease or a sign of a failing body. They are actually a sudden, involuntary contraction of your diaphragm, which is the large dome-shaped muscle that sits directly beneath your lungs and separates your chest cavity from your abdomen. Your diaphragm is the primary muscle responsible for your breathing. When you breathe in, your diaphragm contracts and moves downward to pull air into your lungs. When you breathe out, it relaxes and moves upward to push air out. However, sometimes the nerves that control this muscle, specifically the phrenic nerve and the vagus nerve, become irritated. This irritation causes the diaphragm to suddenly spasm and pull downward abruptly, forcing you to take a quick, sharp breath in. At the exact same fraction of a second, your vocal cords and the glottis, which is the opening between your vocal cords, snack shut to prevent too much air from rushing into your lungs. That sudden closure of your airway is what creates the distinct and recognizable sound of a hiccup. When we look at hiccups explained, it is essentially a highly coordinated, involuntary reflex arc involving your nerves, your diaphragm, and your throat muscles. This brings us to a major question. Why hiccups happen, and what causes hiccups to occur in the daily lives of healthy individuals? In most cases, the triggers are completely harmless and are closely tied to your stomach and your eating habits. Because your stomach sits directly underneath your diaphragm, anything that causes your stomach to suddenly expand or become irritated can trigger a spasm. Eating too quickly or overeating is a primary cause, as a full stomach physically presses up against the diaphragm. Consuming hot, spicy foods, drinking carbonated beverages like sodas or sparkling water, or swallowing too much air while chewing gum can also irritate the phrenic nerve. Additionally, emotional triggers play a massive role in why do we hiccup. Sudden excitement, anxiety, stress, or even a sudden change in temperature can stimulate your autonomic nervous system, causing your diaphragm to react defensively. If you have ever had your day completely disrupted by these uncomfortable physical spasms, please take a quick second to hit that like button to support our channel. If you feel comfortable, please drop a comment below and share the absolute weirdest or most unusual remedy your family has ever recommended to get rid of hiccups. Also, if you know a friend or family member who gets severe, loud hiccups whenever they eat spicy food or drink carbonated beverages, please share this video with them. Spreading health and wellness education is a collective effort, and your simple share could help someone find immediate relief. Now, let us discuss the practical, actionable ways to manage this issue, starting with how to instantly stop hiccups using scientifically proven physical maneuvers. If you want to know how to stop hiccups fast, you have to understand that your goal is to physically reset your diaphragm and soothe the irritated vagus nerve. One of the most effective ways to do this is by increasing the amount of carbon dioxide in your blood. When carbon dioxide levels rise, your brain is forced to focus entirely on regulating your breathing, which sends a direct signal to your diaphragm to relax and stop spasming. The most reliable way to achieve this is through a simple breath-holding technique. Take a deep breath in, hold it for 10 to 15 seconds, and then exhale slowly. Repeat this cycle 2 to 3 times. Alternatively, you can gently breathe into a small paper bag for a minute. This forces you to rebreathe your own carbon dioxide, rapidly raising the levels in your blood and effectively resetting your respiratory rhythm. Another outstanding physical trick involves stimulating the vagus nerve directly. Because the vagus nerve travels all the way from your brainstem down to your abdomen, passing closely by your throat and esophagus, you can physically trigger a vagal reset through specific swallowing patterns. Drinking a glass of ice-cold water without stopping is incredibly effective. The sudden sensation of cold temperature, combined with the rhythmic, continuous swallowing motions, stimulates the vagal fibers in your throat, which can immediately interrupt the spasm reflex. Similarly, swallowing a dry teaspoon of sugar or biting on a lemon wedge can shock the sensory nerves in your mouth and throat, sending a strong sensory signal to your brain that overrules the hiccup reflex arc. This brings us to another popular physical maneuver, known as the Valsalva maneuver. To perform this safely, take a deep breath, pinch your nose shut, close your mouth, and try to exhale forcefully as if you are blowing up a balloon or straining. Hold this pressure for about 10 seconds before releasing. This maneuver increases the pressure inside your chest cavity, which physically stretches the diaphragm and stimulates the vagus nerve, helping to terminate the spasms instantly. If you are looking for a gentle, natural way to help a child or an elderly relative, simply pulling gently on the tongue or applying light pressure to the diaphragm area can sometimes soothe the nerve pathway and provide the relief they need. However, we must also address cases where home remedies are simply not enough. While the vast majority of hiccups are completely harmless and resolve on their own within a few minutes, some individuals suffer from what we call persistent or intractable hiccups. If your hiccups last for more than 48 hours, or if they are so severe that they interfere with your ability to eat, sleep, or breathe, it is no longer a simple annoyance. It is a medical concern that requires a professional evaluation. Persistent hiccups can sometimes be a sign of an underlying medical condition, such as chronic acid reflux, an ear infection irritating the tympanic membrane, or a neurological issue affecting the brain stem. From a clinical perspective, if you consult a healthcare provider for persistent cases, they can evaluate you and offer a specialized hiccups treatment. This medical treatment often involves prescription medications that work by relaxing the muscles of the diaphragm or calming the central nervous system. Medications such as baclofen, which is a muscle relaxant, gabapentin, or even chlorpromazine can be highly effective in terminating long-lasting spasms. In extremely rare cases where medication does not work, a specialist can perform a temporary nerve block on the phrenic nerve to physically stop the muscle contractions. As we look at the big picture of your health, it is important to remember that having hiccups is a completely normal, healthy human response. Your body is incredibly complex, and these sudden spasms are simply its way of reacting to a temporary sensory overload. By understanding the underlying biology, managing your eating habits, and utilizing the right scientific tricks to reset your nerves, you can quickly keep your respiratory system in harmony and focus on enjoying your day. If this guide has helped you understand the biology of why do we get hiccups and has given you a clear, actionable plan to stop them instantly, please support our mission by subscribing to the channel. Don't forget to like this video, leave a comment sharing which of the science-backed tricks work the best for you, and share these practical tips with your loved ones. Your engagement helps us continue to provide high-quality, evidence-based medical advice to families around the globe. Thank you so much for watching. I'm Dr. Matthew Harrison. Take care of your body, be kind to your mind, and I will see you in our next video.